Friends, I'm Dr. Vaishali Bharambe, Professor Anatomy. Now we're going to talk about a condition called Marfan syndrome. Very important syndrome happening because of defective elastic fibers in the person's body. Look at the image here. It's a genetic disorder primarily due to mutation in the FBN1 gene, which codes for the protein Fibrillin-1. So, abnormal Fibrillin-1 is produced, disrupted elastic fibers. Okay. So, what are elastic fibers? Elastic fibers are composed of a core amorphous elastic protein as seen here, surrounded by microfibrils, see the orange dots, made up of Fibrillin-1. So, what do these do? They provide a scaffold in which the elastin is deposited, allowing the fiber to stretch and recoil, giving the tissue a typical elastic property. Now, what happens in Marfan syndrome? Marfan syndrome is a deformity of this very protein, Fibrillin-1. Okay, it's a mutation of Fibrillin-1. So, what will you see? Here you are seeing a normal Fibrillin-1 resulting in strong elastic fibers. Here you are seeing very little or very weak Fibrillin-1 protein resulting in few and weak elastic fibers. Right. So, what are the symptoms of this patient? Connective tissue in his skin, bones, eyes, cardiovascular system, all are weak and fragile. So, what will you see? Okay, come. Tall stature, long limbs, joint hypermobility. You will find that person literally bending his limbs crazily. Skin will show stretch marks. Eyes have problems. Sometimes he or she will have dislocation of their lens. Cardiovascular problems, aortic aneurysms, aortic dissections, and a risk of rupture of major blood vessels. Okay, I'm going to give you an image to make you understand this even better. Look at this. You can see tall stature, long limbs, joint hypermobility. Pectus excavatum. See, his rib cage will be quite prominent. Okay. Eyes will have problems like lens dislocation. He'll have a long neck and a lot of crowded teeth. Okay. Teeth, you will distinctly see crowding of teeth. Okay. Cardiovascular problems like I mentioned, and skin is showing a lot of stretch marks. Disproportionately long limbs. Okay, you will find that you will notice that, oh my God, the arms are reaching way down along the thigh, that normal. That is a person of Marfan syndrome. Okay, so flat feet, very important. Often they have got a peculiar shaped feet which is called hammer toe, typically seen in case of Marfan syndrome. What is hammer toe? Hammer toe is a toe deformity in which proximal interphalangeal joint is flexed. Take a look, giving the toe a hammer-like appearance. See how the proximal interphalangeal joint is flexed. You will also see extension of the metatarsophalangeal joint. That means the joint proximal. Okay, this is typically hammer-like appearance or a hammer toe. The incidence of this condition is about 1 in 5,000 people are born with Marfan syndrome. Okay, are likely to suffer from aortic aneurysm, aortic dissection. So, how are you going to support them? Have regular cardiovascular monitoring for these patients so that you are able to counter these cardiovascular issues before they become a disastrous problem. Right. Okay, so having understood Marfan syndrome, see if you can solve these MCQs. MCQ 1. Which microscopic abnormality is most characteristic of Marfan syndrome? Degeneration of collagen fibers in cartilage, defective elastin deposition in connective tissue, mutation affecting fibrillin leading to abnormal elastin fibers, excess production of reticular fibers. The answer is C. Mutation affecting fibrillin leading to abnormal elastic fibers. The explanation for this is given here. You can read it on your own. Let's try and solve MCQ 2. Which anatomical feature is commonly seen in individuals with Marfan's syndrome? A short stature, broad hands? Definitely not. Long slender fingers? Arachnodactyly? Possible. clubbing of fingers, polydactyly. The answer is B, long slender fingers, arachnodactyly. Typically, the fingers resemble the legs of a spider, hence the name arachnodactyly. So that was Marfan syndrome, my dear students. Students, if you're enjoying this lecture, do please like, share and subscribe to my channel and hit that bell icon. Students, I have a website, VBAnatomy.com, on which you get a lot of detailed lectures, you get surgical anatomy videos, downloadable notes as well as MCQs. The link to which is given in the description section. Do visit my website and learn some more. Thank you. I'll see you in my next video. Bye.